So, as you probably remember, a few weeks ago, I talked about how the California legislature had introduced a bill that would make it an offense to disseminate disinformation by medical providers, licensed medical providers, concerning COVID or other medical issues, I believe. And even though I'm currently no longer a licensed physician in the state of California, I have decided, as I said before, to do my best to comply. So this is my now second attempt at compliance. And for this one, this is similar to a video that I showed a few days ago. The clips here come from the wonderful documentary called The Emperor's New Virus. And in this episode of Compliance Part 2, my goal is so that every listener out there becomes fluent in understanding exactly how virologists and medical researchers proved the existence of HIV and showed that it caused the disease called AIDS. The reason for this is there are many, many similarities, and so not everything is the same, but this was a wonderful historic opportunity we had, spearheaded by some people who I will get into a little bit, to really tell the true story. So as I try to comply with explaining the real narrative, so let me give it a shot. And I'm going to play some clips and then explain it so that hopefully everybody will understand and be able to communicate to friends, family, their medical doctors, exactly how we understood the existence of HIV and showed that it caused AIDS. So here we go. So this is the first clip from a very famous professor of oncology, viral oncology, Dr. Robin Weiss.
What do we mean by virus isolation or virus purification? These are jargon words in virology, and they're not very precise. They mean different things to different people.
Now, Dr. Gallo and Dr. Fauci talked a lot about isolation and purification. Can you tell me what the difference is between the two?
Isolation, what was it?
Isolation and purification.
Of the virus?
Yes.
Well, you isolate a virus by finding the virus which causes a disease. You purify a virus by making a lot of, just by purifying it so you get a pure virus.
Okay.
I don't understand what the issue.
They interchanged the two, and I wasn't sure
I see.
If it was the same thing or if it was two totally different.
Well, it depends on how they used it.
Okay. Can you explain the process of HIV isolation?
Well, didn't Dr. Gallo do that? He actually isolated it. So, yeah. Why should I do all of this? This is all textbook stuff you're asking me.
I'm not quite sure what's behind your question about isolation.
I don't want to be your textbook. You know? I got other things to do.
Isolation is essentially getting the virus from the patient and being able to transmit this virus to another cell to reproduce the infection and to have a continual supply of the virus, and that's called an isolation. Purification is just obtaining the virus free of cellular contaminants or other contaminations, but it doesn't mean necessarily that the virus is infectious.
Okay, so as you can hear, viral isolation and purification are, as they say, indistinct words. So they're basically, as we heard, they're more like jargon. And as Nobel laureate Dr. David Baltimore, who got his Nobel Prize for discovering reverse transcriptase, said, it really just depends on how you use them. So you could use isolation in a lot of ways, doesn't really mean much, and you could use purification. Basically, the way you purify, as he said, is to get a pure virus. So that's very clear. That is how a virologist purifies the virus. That means they get a pure virus. So now let's get into more of the details of how virologists actually found this particular virus called HIV, and we'll explain that in a minute.
What's so special about reverse transcription?
Anytime you're searching for a new agent, you want to have some simple measurement of the presence of that agent. In times past, you would put it on cell culture in the laboratory, and suddenly these beautiful cells will all start turning into dead cells. You say, oh, something's there. And then you put that into an electron microscope and look, and you can find it. All those are rather difficult things to use. If there's something that the virus produces in this culture, you don't necessarily have to see all the dead stuff. You just can take off some of the liquid it's growing in and test it. And one thing you can test for a retrovirus is reverse transcriptase. And it just happens to be that's a laboratory test available for it. So you just take a little bit off, put it into a chemical assay, and you can do it very, very simply. So it's a matter of something that you can put a lot of specimens through and something that's simple to do, so you can really get maybe not a direct picture of the virus, you can't see it, but you can get evidence that it is there, like fingerprints.
Once you have produced, you produce something in the extracellular medium, you can do actually several things. One thing is that if we expect or suspect it's a retrovirus, like HTLV1, the leukemia virus, what we can do is look for what we call reverse transcriptase activity, the enzyme, which is unique to these viruses.
Okay, so Dr. Flossie makes a very important point here, which is really the key and which is what I really want every single person listening to not only understand, but be able to communicate this to everybody. So that is, as these doctors say, the way that HIV is called a retrovirus. Retrovirus means that it breaks the central dogma of genetics. The central dogma of genetics was formulated in a lecture by Crick in 1958. He, of course, because he was a Nobel laureate, he didn't present any evidence, but he didn't need to because he was a Nobel laureate. So without any evidence, he said that the central dogma of genetics is that genetics is a one-way street. There's a fixed DNA, that's the hereditary material. It makes RNA, and that makes protein in a process called transcription and then translation, and it never goes the other way. So then they found that there was these viruses called retro, meaning backwards viruses, and they're retro because they convert RNA, which is similar to the coronavirus, SARS-CoV-2, they convert RNA into DNA. So that's reverse transcriptase. And as Dr. Francis and Dr. Flossie said, reverse transcriptase, we are 100% sure, is unique to retroviruses. Therefore, if you find reverse transcriptase in a culture, you can be, as they say, 100% sure that you have found a retrovirus. Now, let's go over how Luc Montagnier, who unquestionably was the first person who found, isolated, discovered, whichever word you want to use. Obviously, these are jargon words, this HIV. And every subsequent paper, analysis, test was based on this finding of Montagnier. So what did he do? He took a lymphocyte, a T lymphocyte, that's a kind of white blood cell, from a patient with this disease called AIDS. He then cultured this lymphocyte, this T lymphocyte, T cell, in a culture medium that contained many growth factors, including a growth factor called PHA. Then, after 15 days, he did an assay and he found the enzyme reverse transcriptase. And because he, like Drs. Flossie and Francis, were 100% sure that reverse transcriptase is unique to retroviruses, that was the proof, not a proof, the proof that there was a retrovirus in his culture, and that was what was killing the T cells. So that was step one in his experiment. Step two is he took the results of that culture and he mixed it with normal T cells, that is T cells, lymphocytes, white blood cells from a person who had no AIDS. He again grew the normal lymphocyte in the culture fluid that he was 100% sure, because of the presence of reverse transcriptase that contained this retrovirus. And after 15 days, he assayed and found reverse transcriptase. And that proved that the retrovirus was transmissible to the normal T cells, the normal lymphocytes, and therefore HIV, this new retrovirus, was a transmissible infectious agent. Again, that was not a proof, that was the proof. In step three of his experiment, he took some of the supernatant, which is the liquid from the second culture, right? So this contained the virus, because we know that only reverse transcriptase is unique to the retroviruses. And he mixed that with umbilical cord lymphocytes. These are white blood cells from the umbilical cord of a human baby, I guess. Again, he added PHA and cultured it. And then he again found the presence of reverse transcriptase. And then, as we'll see, he did an electron micrograph of this cell culture and found evidence that suggested the presence of the retrovirus. I don't know what more proof you could want than that. So let's go to the next slide. This slide is a slide of a summary of the work of Dr. Gallo et al. In 1973. So this was 10 years before Montagnier's experiment. And in there, he says that they found that reverse transcriptase was present in white blood cells, lymphocytes that had been stimulated with PHA, but not from unstimulated normal lymphocytes. In other words, it is 100% clear and sure that reverse transcriptase is found in cultures that contain no possibility of having any retrovirus. That's what the scientific literature, as Dr. Gallo states here in his paper. Again, to be clear, it is 100% sure that reverse transcriptase is not unique to retroviruses. It is found in stimulated with PHA lymphocytes that are from leukemia patients and from other things. So let's go to the next slide.
Retroviruses, the only ones that can reverse transcribe.
No. There are other forms of reverse transcription that are used in various ways inside the cell. For instance, the ends of chromosomes are made by a reverse transcription process. That's how they're maintained stable. There is reverse transcription in the inheritance of all of our cells, which comes about from endogenous genetic elements in the cells or in the cells of our ancestors. Because once that information gets into our cells, into our genomes, it stays there forever. So it could be that we've inherited information from monkeys or from other animals that are in our lineage. And so, no, reverse transcription is actually very widespread. Something like 50% of the DNA in our cells comes about by reverse transcription.
Oh, that much?
Yes.
Oh, wow.
Okay, there is some evidence that Dr. Baltimore actually did descend from monkeys. There's some peer-reviewed journals that state that. But the important point that he makes here is it is very clear to this person, this scientist, esteemed scientist, who was the discoverer of reverse transcriptase, that reverse transcriptase is not only not unique to retroviruses, that's 100% sure, but is found in basically all cells, and that all cells in culture, if they're stimulated with PHA, will create or evolve, or you will find the presence of reverse transcriptase. So there is no possible way that you could use an assay for reverse transcriptase to prove or document the existence of a retrovirus, new or otherwise. And as Dr. Baltimore says, he is 100% sure about that. Now, some of you astute listeners may be actually confused now, because you may realize that in the first few slides, the doctors, remember, we're trying to comply here, and so we're trying to explain the science. So again, the first three doctors, scientists, explained that the way that they found that the virus existed in their cultures was by assaying for and finding the presence of reverse transcription and the enzyme reverse transcriptase. And the last two, Gallo and Baltimore, say it turns out that reverse transcriptase is a component of all cells. The central dogma of genetics, as formulated without any evidence by Francis Crick, is simply a myth, and they are 100% sure that no assay for reverse transcriptase could possibly prove the existence of a retrovirus. So some of you may be wondering, how can this be? And after thinking about this for quite a while, I realized that this is because of a fundamental misconception about viruses that many of us share. In particular, I would point out the work of this guy, Kaufman, and this gal, Vollmer, who use logic and common sense and science and reasoning to point out the discrepancy in these two positions and how both can't be true. But the reality is that viruses do not use logic and clear thinking and scientific reasoning and logical conclusions. Viruses are much more intuitive organisms. They are more of an art form than a scientific particle. They can't be proven. In fact, there's some clear evidence that viruses technically are basically relativity organisms. They're also maybe technically could be called quantum relative organisms. And attempting to understand them through reason and science and logic is simply misguided. Now, a very good practitioner of the intuitive, illogical, unscientific method of understanding viruses, which of course understands the true nature of the virus, is explained by the woman doctor on the Corona committee, I can't remember her name, I think it's Dr. Errata or something. She gives a very clear presentation documenting the irrational nature of the viruses. So I think everybody should go and take a look at that. And then let's take a short break from our advertisers, and then we'll come back and talk about the electron microscopy proof of the virus. What's that? We don't have any advertisers. So we don't have any advertisers and we don't have any sponsors. I mean, who's the moron who runs this site? It's me. Oh. Oh, sorry. Yeah, let's get back. All right, let's move on to electron microscopy.
Retroviruses.
Could you look on them under the microscope, whether you can see virus particle, and if it resembles to a retrovirus?
Okay.
Okay.
And what did you see? What did you guys see when you looked under the electron microscope?
And after quite, it was very difficult because it was only few cells infected, so it was a very difficult task for him to find a cell that was just producing this particle, but finally he found it. And he found one lymphocyte with a budding particle, typical of retrovirus, and very close from these cells, one complete mature particle that resembled to a retrovirus.
Okay, here we see the electron micrographic proof for the existence, as she says, after arduous search, diligent science, we find the presence of one particle, there it is, that has some resemblance to a retrovirus in an electron microscope. I don't know what better proof you could have than that. And now let's turn to an expert in electron microscopy and see what he has to say.
See in these publications stamp-sized images. It's a nuisance. It's a nuisance. You do not really see much. And I do not know how good electron microscopy was really done, but they probably should have done a bit more, and then they would have been very safe. And electron microscopy is an art and a science. Art and science, and nobody is able to judge what the electron microscopist is really doing. You have to have experts discussing these things. Sometimes people are far from the microscope. They do not understand structure and function. They like to have a nice image, that's all. They do not understand sometimes, and that's a danger. I could imagine if Montagnier would have pushed the structure, the fine structure of HIV a bit more, he would have been more convincing.
So, as you can hear from Dr. Gelderblum, who I think was the head electron microscopist of the Robert Koch Institute for many years, it's very clear that these electron microscope pictures are a nuisance. And as I pointed out, we need an intuitive understanding of viruses, not an actual logical or realistic or scientific, because as he very clearly points out, electron microscopy is an art, not a science. And so you have to use an artistic sense, and only experts who are well-versed in the artistic exploration of viruses are able to do this. And one final picture, here we see Montagnier on the right, my right, picture of the type C particle that was budding off the membrane. You see it, don't think I have a cursor there on the second to the left of the right side of the slide. And then on the other side, you see placental, which means coming from umbilical cord lymphocytes, would have the exact same type of particles. So it takes a very artistic sense to differentiate between these two, because to the untrained eye, without the expert artistic sense of somebody like Gelderblum, there is no way that anybody could say this is a retrovirus on the right and this particle on the left is not a retrovirus or is only coming from the breakdown of the lymphocytes from the placenta. And so just to emphasize the artistic nature of virology, I thought I would show you two very clear pictures that prove the existence of different animals in our world. So here's the first, and that obviously is a cat eating a bird, and that's, as we all know, exactly what cats look like. And here is another cat. I think Picasso must have been very interested in cats, and that's very similar to how Fluffy looks. And so there's no doubt that that is an image of a cat, very similar to electron microscope pictures that without a doubt confirm the existence of the virus and the proof that this virus that they found is the cause of a disease called AIDS. And as I often ask my patients and in small working groups, if you had to choose between two things to do or to be exposed to in your life. So number one would be many of these particles. So that's one option. The second option would be to go for 1 year of being socially ostracized, socially disempowered, emotionally cut off from friends and family, hardly eating, taking many recreational drugs, taking many courses, in fact, continuous courses of the most toxic antibiotics and antifungal drugs, having anal intercourse up to 100 times a week, using amyl nitrate poppers, one of the most toxic drugs there is. Which would you choose as more likely to do you harm? And I think everybody can think about that, and maybe they'll come to an answer which would confirm, as we're trying to be compliant here, that everybody should definitely be scared of this particle, because whether it comes from the placenta or a retrovirus, which is impossible to tell, it certainly can scare the shit out of all of us.